Joining us now with more is Dr. Elizabeth Comen. She's an oncologist at Memorial Sloan Kettering Cancer Center. Thank you so much for being with us. And you're one of those people doing the very cool work. We've heard about President Biden's big cancer initiative. How does that affect people like you who are there on the front line?
Well, it's an extraordinary initiative with two critical goals. First, to decrease the number of cancer deaths by 50% over the next 25 years, and just as importantly, to improve the lives and experiences of those patients and loved ones suffering from cancer. And it's not just about doctors on the front lines, but most importantly, patients. I think we can all agree that we all want to see the end of suffering, as we know, from cancer today.
Mm-hmm. And you're wearing pink today.
Yes.
October is Breast Cancer Awareness Month. There are some advancements in breast cancer treatments. Tell us about those.
Absolutely. It's been such an exciting year for breast cancer treatment. So one of the most challenging types of cancer to treat is metastatic breast cancer, which means breast cancer cells that have spread from the breast to another part of the body, like the liver or the bone. And a new treatment, an FDA-approved treatment called Enhertu or TDXD, is being used to improve the survival of patients with a new classification of metastatic breast cancer called HER2 low metastatic breast cancer. So for anybody watching, if they or their loved one has metastatic breast cancer, it's critical that they ask their doctor, do I have HER2 low breast cancer, and might this be an appropriate treatment for me?
Screening is critically important for people. But in the pandemic, we saw the numbers dropped over 2 million. What does that statistics say to you? Are you concerned about that?
I'm more than concerned. I am terrified by that for the following reason. We know that early cancer detection, and with respect to breast cancer with mammogram screening, saves lives. And it's not just about saving lives, but when we detect cancers earlier, that means less invasive treatments, less invasive surgeries, less toxic therapies. So we all know it's hard to remember to schedule things, but now is the time to kickstart that. And if you're due for your mammogram, please go and get it and talk to your doctor.
We just have a tiny bit of time left, but who should be getting screened?
So for the average risk woman, you want to start screening at age 40 with mammograms. Ask your doctor if you have dense breasts and potentially need ultrasounds as well. If you have a family history of breast cancer or a known genetic mutation, incredibly important that you talk to your doctor about starting screening perhaps earlier than age 40.
Dr. Comen, thank you so much for being with us this morning and for all of those advice.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.